Those of us who've had cardiac and cardiovascular conditions are aware that chronic inflammation, often caused by a poor diet, among other factors, can exacerbate atherosclerosis and coronary heart disease. Certainly, inflammation isn't always a bad thing. It initiates the process of repair with injuries, with infections. But when inflammation is chronic, well, that's a whole nother conversation. Cardiovascular disease, asthma, rheumatoid arthritis, type 2 diabetes, among other diseases, can be triggered and made worse by ongoing inflammation. Tonight, we're joined by cardiologist Dr. Monica Aggarwal, who knows firsthand about inflammation, both as a doctor and a patient. Hi, everyone. I'm Jim Spellos from Planned Parenthood Metro New York, along with my co-hosts Judith Surden and Ben Martins. We welcome you to this episode of Heart to Healthy Heart, plant-based conversations that can save your life. As always, we encourage you to use the chat box to tell us where you're viewing from, as well as to ask any questions of our special guest. And as always, we'll get to as many questions as we can as our 30-minute time slot will allow. Let's bring on the screen Dr. Aggarwal and everyone else so we can introduce her properly and get this all set up. So Dr. Monica Aggarwal is a board-certified cardiologist specializing in preventive management of heart disease with lifestyle techniques in conjunction with medications. Recently named Florida's Cardiovascular Researcher of the Year, she conducts research on nutrition education in medical institutions and on the impact of plant-based diets in cardiovascular disease. She's also a fellow of the American College of Cardiology, where she's a member of the Nutrition Council working on nutrition policies for the nation. A triathlete and author, Dr. Aggarwal is published in major medical journals such as the Journal of the American College of Cardiology and the American Journal of Medicine. Most recently co-authored Body on Fire, How Inflammation Triggers Chronic Illness and the Tools We Have to Fight It, as well as the Body on Fire Anti-Inflammatory Cookbook. Dr. Aggarwal, such an honor to have you here. Thank you so much for your time tonight.
Oh, it's my pleasure. Thank you so much for having me.
Well, let's go with the first question. I'll ask the softball question, which is, how did you get to a plant-based diet? Remember, we only have a half hour for the entire show, but if you can give a synopsis of your story leading up to that, that would be awesome for the audience.
Sure. So as you pointed out, so thank you for the kind introduction. I'm a plant-based cardiologist. I'm a preventive cardiologist. After I had my third kid, I developed a debilitating form of rheumatoid arthritis. I was diagnosed, I was already vegetarian, but I wasn't sort of the healthiest vegetarian. And so started learning about the connection between food and the gut and inflammation, and changed my diet, among other things, made a whole bunch of lifestyle changes, and was able to really improve my inflammatory disease.
Fantastic. That's good. Let's get you in the main part of the screen and me off of that. That's much better. So there's one more question about that, which is the choices you made in terms of the diet that you changed to. Was it all like an overnight change because of the rheumatoid arthritis and the inflammation?
So again, it was maybe easier for me for many reasons to change my lifestyle, because I was already vegetarian and I'm Indian, and being Indian, I was always exposed to a lot of spices and flavors that maybe other people are a little not as familiar with. And so it was easy to sort of slide into a plant-based lifestyle, to be fair. But for me, I'm the type of person that does really well. You have one of those moments where I always call it the kick in the pants moment. And unfortunately I had one of those, and I thought, okay, well, if I'm going to give this a go, I really just need to go in fully. And I, as one of my posters says, and my tea mug says, let's not do this half-assed, let's do this full-assed. So I went in full on. Within a couple days, I changed everything.
Amazing.
I jumped into it that way too. But so the next question is the connection between inflammation and cardiovascular disease.
So I think what you have to maybe start further back and ask, what is inflammation? And then when you start there, you say, well, what is inflammation? And inflammation is when your body's mad at you, and there's usually an imbalance between the resources in your body and the demands that you put on your body. And demands are things like stressors in your body, lack of activity, poor diet, lack of sleep. These things are stressors on your body. And when there's an imbalance between the two of them, you develop inflammation. So inflammation is the nidus or the trigger for many diseases, not just inflammatory arthritis. You can see this in multiple diseases, including heart disease. And so you may have cardiovascular risk factors like high blood pressure, or diabetes, or high cholesterol. These are cardiovascular risk factors. And then if you add to them, so those risk factors put you at risk for plaque in your heart. And if you start building plaque in your heart, so let's go back even a little step further. So if you have diabetes and high blood pressure, or high cholesterol, these are heart disease risk factors. And what happens is the blood vessels in your heart, which are usually smooth and they are prone. So a blood vessel of the heart, I'm going a little all over the place, sorry. So when you have a blood vessel of the heart, you first have your heart, and there are all these coronary arteries on them. And those coronary arteries are on top of the heart and they feed the heart. Okay. So their job is to give the blood flow to the heart so the heart can pump and push blood to the rest of the body. And when you have a risk factor like diabetes or smoking or high cholesterol, what happens is those soft blood vessels, which are open and close, they get damaged. And when they get damaged, they build small plaques in them. And those small plaques then become an area or a focus where all the cholesterol can attach to, and all these sort of abnormal deposits can attach to, and it builds a little plaque. So if this is your artery, then you build this plaque in your heart that looks like this. So this is how you build plaque, or that's heart disease or heart plaque. But what happens is that if you get inflammation or irritation, these plaques become unstable and irritated, then this plaque goes from being this big to rupturing. And it closes off the whole vessel, and that causes a heart attack. So there are multiple things that trigger heart disease or a heart event or a heart attack, but inflammation is often the trigger for a plaque to go from here to go to here.
Thank you.
Doctor, what is the relationship then between inflammation and rheumatoid arthritis?
So all of the diseases, like you can look at cancer, or you can look at heart disease, you can look at inflammatory arthritis. They all are bound together by inflammation. So if you have this imbalance between the stressors and the demands and the resources in your body, you trigger this inflammation. And people have a genetic predisposition to certain illnesses. I had a genetic predisposition to rheumatoid arthritis. So this inflammatory process can then sort of, with you already having that gene sort of predisposition, the inflammation plus the gene process can activate the gene and trigger more inflammation and trigger illness. So I often explain to people to think of a very important illness that is maybe explains this the best, and that's celiac disease. And celiac disease is when you have an allergy to gluten. Your body cannot take gluten. There's no way to fix that problem that we know of. It is an allergy, and it's other than to restrict gluten. You cannot eat gluten foods. But when a person who has celiac disease doesn't know it and they eat gluten, then what happens is it goes into their body, it goes into their gut, and it actually breaks the junctions of their gut and causes inflammation. And when you get inflammation with celiac disease, initially it's just in the gut. So you might feel uncomfortable, you might feel diarrhea, you might just feel abdominal symptoms. But over time, with continuous intake of gluten, you get more and more inflammation. And that inflammation doesn't just stay in the gut, it goes all over the body. So you can get it you can get skin changes, you can have headaches, you can actually have seizures, you can get rashes, you can get arthritis. So if you understand and think about that, is that just something you put in your body can then trigger inflammation, which then can trigger systemic symptoms. So when you think of that, then you should think about all these other illnesses like rheumatoid arthritis and all these. So that inflammation just doesn't just sit in one place. It can go to different places and it can go to your joints. And if you're predisposed to an illness like rheumatoid arthritis, then it will trigger inflammation in those joints. So for me, the small joints of my hands and feet.
Yeah. Great.
Can eating a whole food plant-based diet affect inflammation or decrease the level of inflammation in one's body?
Yeah, so studies have shown this already. So this is not new data. We know that eating a plant-based diet will reduce inflammation. So if you compare in heart disease patients, a study was done at NYU that looked at inflammation and heart disease. And they said, okay, well, let's put people on a plant-based diet, a whole food plant-based diet versus a American Heart Association diet. And this is sort of years ago now, but and what they did was, and they put these patients after they'd been through the cath lab. So they were actually already at heart disease, known heart disease, and they get put on either American Heart Association diet or a plant-based diet. And what they were able to show is that the plant-based diet decreased inflammation more than an American Heart Association, quote unquote, healthy diet. So eating plant-based will absolutely decrease your inflammation. I think what people get confused about with plant-based is there's a lot of plants that aren't healthy. And so understanding that when we're talking about eating plant-based, we want you to eat healthy plant-based foods, lots and lots of fiber, no processed foods, right? Oreos and Coca-Cola are plant-based. And so sort of, I guess they're sort of plants anyway. Now there's a lot of chemicals in them. And then if you eat those, you're not going to be healthy. Or, a lot of these impossible meats and those things, which are very high in fat, they're not healthy for us. And so I think that understanding that when we're talking about the foods that decrease inflammation that are good for the body, we're talking about whole foods, beans, greens, fruits, veggies, nuts, seeds.
Thank you. So can you just tell us a little bit about the role that the microbiome plays in inflammatory disease?
Sure. So the microbiome or the microbiota, which are the gut bugs, so those are the gut bugs in your gut. And you have millions and millions of them. You have so many bacteria in your gut. And you can either have healthy bugs or unhealthy bugs, but you have so many bugs. And so most people have a lot of everything. But when you eat diets that are highly processed, refined foods, and high in animal products, refined foods, processed foods, and low in fiber, you're going to have bugs in your gut that are associated with more illness, like heart disease and diabetes and kidney disease. And when you eat foods that are high in fiber, low in processing, not refined, complex carbohydrates, more plants, you actually have these healthier bugs in your gut. And so there's healthier gut bugs, there's changes in your metabolites that your gut makes, there are decrease in the inflammatory markers, all that happen by switching from that sort of unhealthy diet to a healthier diet. So when you eat those healthy foods and you have those strong gut bugs, then they are not as likely to trigger any inflammation. Because I always like to tell people, imagine that when you eat healthy foods and you eat high fiber, you're making this massive barrier in your gut so that things can't get through into your bloodstream to cause inflammation.
Thank you.
Can you share your nutritional myth?
What do you mean?
I read some article, you were talking about nutritional myth, correct? And
so nutritional myths that I may have talked about, is that what you're asking?
Yes.
I think that I'm not sure specifically which article you're referring to that I wrote. I do write and talk too much. So I'm not 100% sure which one, but some common myths that are out there. Let's see. So I think that sometimes people focus on the wrong thing. I'm not the type of person that believes that there is only one way to heal the body. In other words, perfection is not my goal. My goal is to get really darn good. And so when I tell patients how I want them to eat is I want them to eat as many plants as they can, but I try not to focus so much on when people have a little of this or a little of that, because it's not so important. The little things here and there are not so important as the big picture of just eating a lot more plants all of the time. What other things? I think the other things that people often feel, they often feel like if they're eating plants, they're healthy no matter what they are. If it says plant-based, that means it's healthy. And remembering that half the time, a lot of these plant-based foods, they've compensated by eating there's a lot of fat in them. Often they are very refined, and those are not healthy foods. Another nutritional myth I hear a lot of is people who eat gluten-free because they think that being plant-based means you should be gluten-free, or that you're going to be healthier if you're gluten-free. And that's a misconception. That complex carbohydrates, if you do not have celiac disease or gluten sensitivity, you should eat complex carbohydrates, and wheat and gluten are fine to eat. Often people don't realize that when they take gluten out of foods, that they often will add in fat and sugar to compensate for the lack of gluten, and it makes the food actually fattier and less healthy.
Mm-hmm. How has adopting a plant-based diet affected your practice as a cardiologist?
So maybe if anything, it's focused. I get a lot of referrals from around the country, probably more so because people want to change their lifestyle and they would like me to show them how to do that. So if it's changed my practice at all, it probably brings in more patients that are very focused on nutrition. Other than that, I think I'm a preventive cardiologist, and I've been one now for almost 15 years. I've always focused on nutrition and lifestyle, but I think I'm better at it now that I've learned and done a lot of the education. I've spent a lot of time on learning how to heal the body and heal the gut and decrease inflammation. And I think that I have certainly more to offer in that space than I did 10 years ago.
I need to ask a question, because my mother-in-law had rheumatoid arthritis, and I just don't understand what that is and how that differs from osteoarthritis.
Oh, sure. Osteoarthritis and rheumatoid arthritis are totally different processes, in the sense that osteoarthritis is a mechanical issue. So it happens from wear and tear. And so as we age or as we gain weight, we put more pressure on our joints. And so we can trigger irritation because the joint, you lose the fluid in between the joints, and you put a lot of weight on it. If you have a lot of weight on you, or you don't have a lot of muscle, then those joints where there's already less fluid, as we age, they start rubbing against each other. And so you get damage to your joint because of just the two joints hitting each other instead of having that space in between. This would be normal, and this is sort of where it is with osteoarthritis. And that triggers inflammation as a secondary, because you're just irritating the skin. You get swelling and inflammation from that. That's a little harder to treat, in the sense that the best way to treat that is through muscle building exercises, losing weight, and strengthening your muscles, more activity, and reducing your weight. The rheumatoid arthritis starts out as an inflammatory disease. It's your body attacking itself. So it's an autoimmune condition, which means body attacking itself. So your body decides that for some reason that those joints, the small joints of your body, are suboptimal, and it starts attacking them. And so you get inflammation and joint damage because of your body doing it to itself.
We have a question from one of our viewers I'd like to just put up on the screen right now, which is, should someone on a whole food plant-based diet, from your perspective, should they be taking a vegan omega supplement? There's so much controversy about omegas and what type of fats people should have. So what do you think?
I don't know. I mean, I think that we don't know enough. I think the data on omega-3 fatty acids is pretty confusing right now. I think there's enough for and enough against omega-3 fatty acids. There are highly concentrated forms of fish oil called, there's marketed as a brand called Vascepa, 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 which is 100% purified EPA. And that has the only sort of medication, which is highly purified EPA, that's been shown to decrease mortality. We don't really have a whole lot of data on supplements that's impressive. So I think that you can try it out and see if it makes you feel different. But I don't know if we have enough data to advocate for it. Now, if you have elevated triglycerides, maybe it'll help, but maybe it won't. I mean, again, I think the supplement industry is its own animal, and there's so many issues with quality, the fillers that they're adding to the supplements. So I'm not a huge fan of supplements in general, but I think that you can certainly give it a try. I have certain patients that you do use the vegan omega-3 plant supplements, but I'm not sure that it should be a requirement. And there are very few supplements that I think a plant-based person needs to have, and an omega-3 is not necessarily one of them.
Interesting. But flax, chia, walnuts, all good for the omega-3s, right?
Right. So like if you're going to get food, if you're going to try to get omega-3 fatty acids, it's always better to eat them. So, chia seeds, flax seeds, walnuts, almonds, these are really good sources of omega-3 fatty acids, and something that I think all of us should be eating on a regular basis.
Okay. So just skipping over to your research, I know you've been doing a lot of research into nutrition. Has any of your research validated your personal experience about the benefits of a whole food plant-based diet?
So I don't do research on and rheumatoid arthritis. So I don't do any research on rheumatoid arthritis. I do research on inflammation related to heart disease. And so I'm just actually finishing up a really interesting study that we're writing up. So I can't tell you the details too much, other than we took patients who had at least borderline risk for heart disease, and we put them on a plant-based diet, but we randomized either to high olive oil or low olive oil. And we wanted to see does the patient do better with high olive oil in a plant-based diet or low olive oil in a plant-based diet. And we are writing up that paper right now. So that's exciting.
I can't wait to see that one. Questions from our audience are coming in. One is a coronary calcium score a good test to take? And someone says they read this only measures hard plaque. And can you measure soft plaque?
So it is a good test for some people. It depends on the person, and it really needs to kind of be individualized. So I use coronary calcium score in patients who kind of have strong family history, or they have multiple risk factors, and they don't want to take a statin, or maybe they don't have multiple risk factors and they have really high cholesterol, and I want to understand their risk of disease and how much plaque that they have. So yes, coronary calcium score is in about an 8-minute X-ray. It's a CT, but it's sort of just radiation to your chest wall to look to see if you have plaque in your heart. It only shows old hardened plaque, and it won't show you soft plaque. That's true. But there's mortality data based on calcium scores. In other words, if you have a calcium score over a certain number, depending on your age, we don't like it, and we know that that's associated with higher risk. And so we would be more inclined to give you medication or be more aggressive with your lifestyle, et cetera. So it becomes a great tool to kind of tell people where they are, especially in patients who might have high Lp(a) or high lipids or high family history, and they're not sure if they want to be on medications or not. Soft plaque can be detected through something called a CT angiogram. And the CT angiogram does require contrast dye. And so you'll get contrast. So if you have kidney disease, it's not an optimal test, but you get some dye, it goes through your kidney, and then you're able to see some of the soft plaque, which is how we can detect that. And, that's a very useful test. And I do expect that CT angiogram is going to become sort of, if it hasn't already become, it's really become the future of cardiology diagnosing.
So a follow-up question came in about the Clearly test about soft plaque. Any thoughts about that?
Yeah, I think the Clearly CT is very interesting. I've looked into this and I've actually written papers on the Clearly CT. If you look up my name and Clearly CT, American Journal of Medicine, you'll see my paper. And I would say that I think that the Clearly CTA is very interesting. I think that it has the ability to look at plaque in a very unique way and better than sort of the standard CTs. But don't fret if you don't have one in your town, because they're not all over. CT angiograms have gotten better and better with time, even if you're not getting the Clearly CTA.
Doctor, I got a stent question. Does a stent prolongs one's life?
Do stents prolong one's life? No.
When should someone agree to getting one?
You should think about stents when I shouldn't say that stents don't prolong your life. So if you have had an acute heart attack and you're in the hospital with an acute heart attack and an emergency, you're brought into the cath lab and you are having a heart attack on the table right that moment, then putting a stent in there will save your life. So you should absolutely get that stent put in. You should not fight that, because the data shows that if you get that stent, you will do better. Like I said, we will save your life. When I said that stents make you live longer, when I was thinking of patients who don't have an acute heart attack. So the data shows that people who have angina or have some heart disease, if you put a stent in those patients, you're not going to make them live longer, but you will improve their symptoms. So there are some people, and I have many in my clinic, that despite being on optimal medical therapy, despite really good diet, they still have angina and it's life limiting. And so I will send them for a cath and we'll put stents in if we need to.
Going to ask a long question and try to paraphrase it, but talking about their mom who's followed whole food plant-based, hopes of reducing chronic inflammation and moderate pain, but she's yet to observe any change in pain or inflammation. She's discouraged. And the question really boils down to, is there a point when such a dietary change doesn't have any effect?
And how long has she been on it? Can you go back?
I can go back and it looks like she's been past 6 months. 6 months.
I think things take time. And the longer you've been eating a certain way and the gut is sicker, it takes time to feel better. So, I think, I have a different feeling about 93-year-olds in general. So my feeling on that is that you made it to 93, you're doing great. I would just do the best you can, and not to be discouraged, live your life and do the best you can. With that in mind, is there more hope for her? Yeah, in terms of whole food, plant-based eating, for sure. I think that it just takes longer for some people because some people's bodies are super sick and it takes time to reduce that inflammation.
Cool. One last question, Judy.
Well, I mean, just generally, what is the role of stress in cardiovascular disease?
So stress is one of those stressors that puts demand on the heart. And so in times of high levels of stress, there's more inflammation, which can trigger more illness. So, there's actually a syndrome. Somebody asked me about this today. And when I was seeing patients, they said, can you actually have a heart attack from a broken heart? And so the answer is yes. So there's actually a syndrome in cardiology called broken heart syndrome, or Takotsubo, which is a weakening of the heart and can be associated with a heart attack, EKG changes, chest pain that's associated with high levels of stress. And so I think, so can stress trigger damage to the heart or inflammation or heart event? Yeah, it can. And so that's why I always tell people, because I'm not a one way is the only way kind of gal, because I think that you have to work on so many different things to heal your body. You have to work on your lifestyle in multiple ways, not just on nutrition. If you have a high stress life and you're not sleeping and you're constantly moving around and in intense and worried all the time, and you're eating plant-based, well, that's great, you're eating plant-based, but you have to try to work on those other components too, because more than one thing triggers inflammation and illness. and you have to sort of lean in and allow yourself the time to heal in these other spaces as well. And because people come to me all the time and say, I don't understand, I'm eating 100% whole food plant-based and I am not better. Why is that? So part of it is you have to kind of, accept that things take time and forgive the process and forgive yourself for life being imperfect. And it's imperfect. And there's so many things that trigger illness, and it's hard to fix all of them at once. And you just have to kind of honor your body, honor yourself, take your time, try to fix a little bit every day. I always tell people, try to get a little bit better every day.
We just got one question coming in before we have to end up, but can a whole food plant-based SOS-free diet help offset the risk of heart disease associated with breast cancer treatments such as radiation and chemotherapy?
Probably. I mean, the question as a scientist can't be answered because we don't know, right? That study will not be done. No one will ever do that study. But if you believe, which I do and know from studies, that eating plant-based reduces your risk of heart disease, then any sort of extra disease that you might have incurred by getting radiation to your left breast or excessive amounts of chemotherapy, you're hoping that you're decreasing or counteracting some of that. Now, is it perfect? I don't know. It depends on how much radiation, how everybody's body, everybody's genes. What I always tell people is this, is that we know that dietary changes and lifestyle changes work. And you may not completely resolve your issue or reverse your issue, but imagine if you didn't make those lifestyle changes, you'd be so much worse off from your illness. So you have to think about it as, and I always tell people, it's like the 1-2 punch. Like, why wouldn't you take the right medication and do all the dietary and lifestyle changes to heal your body? Because you got to do whatever you need to do to keep yourself healthy and strong.
Great words. Dr. Aggarwal, we are so appreciative of your time tonight. On behalf of Judy, Ben, the entire community, thank you for your time. Thank you for your thoughtful responses. We really, really appreciate it.
No problem. Have a nice evening. Take care.
Right. And let's just wrap it up with everyone else. Let's get us all together, because we are, believe it or not, coming up with this show at the 1 season mark, 1 full year of Heart to Healthy Heart. Judy, Ben, all I can say is what a great team we have. And thank you both so much for all you are, all you do for our organization and for the community. And what a great year it's been. Dr. Ostfeld, Dr. Williams, Dr. Gubizita, Dr. Reddy, Michael Greger, Caldwell Esselstyn, Andrew Freeman, Lee Ettinger, Michelle O'Donoghue, and tonight closing with Dr.
Williams. Dr. Williams.
And I hope I mentioned Dr. Williams, otherwise I'm going to get in big trouble. But an amazing doctor. So how do we begin year 2? I'll tell you how. Dr. Neil Barnard coming on our show next month, June 21st, to talk about the intersection of diabetes, type 2 diabetes, and cardiovascular disease. So if you want to watch any of our episodes again, please do come to the Whole Food Plant-Based, the Plant-Powered Metro New York channel. And on behalf of Judy and Ben, I am Jim Spellos, wishing you all a wonderful evening, optimal health, and see you again next time on Heart to Healthy Heart.